My name is Tuan Vu. I'm a professor of neurology at the University of South Florida in Tampa. I spend my time seeing patients with neuromuscular diseases, including Myasthenia Gravis. I also participate in several studies involving newer therapeutics for Myasthenia Gravis. Myasthenia Gravis is actually a pretty unique disease, even though it's rare. It is a perfect model to test treatment against autoimmune disorders because we have all the diagnostic modalities that we can use to make an accurate diagnosis. We also have different measures that have been validated to test different medications, and there's effective ways to treat this disease that we have not had before, and there's a lot of focus on developing additional treatment. We have several older medications that may or may not be effective, but they have a lot of complications and side effects. The newer medications provide proven benefits and also less of a treatment burden on the patients. So I think it's definitely a way to better manage the condition. So I made two presentations so far. The first one is on Nipocalimab. It's the top-line results from the recently completed Vivacity study. The studies show that Nipocalimab has a durable and efficacious benefit for a patient with MG over the 24 weeks of treatment. It's giving in fixed cycle, so the response was seemed to be constant and statistically significant change over placebo in several different measures. Patients who are on Nipocalimab achieve a 4.7 points improvement in the MG-ADL and 4.9 point improvement in the quantitative MG scale. These are statistically significant and can lead to relief of symptoms. The effects seem to be durable over the period that we tested for, and the side effects was very well manageable. This is another option for the future. The drug is not yet approved by the FDA, so it's not available currently, but we hope that in the near future it will be another option that the patient can take in the management of this disease. My other presentation is on the CAR T-cell therapy for generalized myasthenia gravis. Basically, we take the T-cells out and engineer them so that they recognize certain markers on plasma cells and plasmablasts. And by inhibiting these cells, you reduce the antibody levels, and by doing so, we hope to decrease the symptoms of MG. And in the phase 2b studies, we have shown that patients who were treated with this cell therapy had significant improvement in composite scores, ADL and QMG score as well. And again, the side effects were pretty well tolerated, and we don't see the more serious complication that we often see with DNA-directed CAR T-cells therapy. I think the signal that we got from this study indicated that it's safe to progress to the next phase, which is a phase 3 study, which we hope will be done in probably next year. Up until about 2017, we did not have a lot of options, and many of the options we had previously was not really truly tested in clinical trials. Since 2017, we now have 5 approved medications for these medications, and these medications basically deal downstream, so-called downstream, because we sort of mitigate the effect of antibodies. At this meeting, we now have data from several studies that show potential benefit upstream at the level of the B cell and T cells. And that's a really exciting development, and I suspect that in the near future we would have several treatments on the market that will be extremely helpful in control this disease. I think it's an exciting time for patients with MG. Not so long ago we didn't have any options, and now we have a lot of options, and I suspect that we will have really effective treatment and hopefully one day soon a cure for this condition.